Good afternoon. Here's the update on the coronavirus. We are seeing an increase in the daily case counts here in Philadelphia and in the region. So here's more detail. Since this time yesterday, we identified 228 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 29,102 since the beginning of the epidemic. Now, that high daily number of 228 is in part because we received a huge number of tests this morning. Since yesterday, nearly 4,200 tests. To give you a sense, that's more than twice what we typically get in a single day. And the positives that we're reporting today actually were reported by the laboratories in the last few days, so there's delays in reporting. Nonetheless, though, this is reflective of an increase. Now, the past week that ended last Saturday with the updated cases averaged about 139 cases per day. And put that in perspective, the week before was about 110 cases per day. So overall, the trend is increasing. Of these cases, the new cases are predominantly younger people. 38% were under the age of 30 and 61% were under the age of 40. Now, just to update you on some specific settings as far as where the infection is going, in nursing homes right now, we're seeing very little signs of infection. Of the 46 nursing homes in the city, 40 have had no cases at all in the past 2 weeks. In the city's jail, I reported last week that there was a cluster where one inmate tested what was symptomatic, and after that, they screened 64 inmates in that unit and found 23 positive tests. Those 23 they screened had no symptoms at the time. After that screening, one of those persons with a positive test subsequently developed symptoms. The other 22 did not develop symptoms. They've actually finished their isolation period. They're going out of isolation today. The other inmate who did have symptoms is remaining in the jail, but has not been taken out of isolation. And if you're interested in what's going on in the jail, the numbers on our tests and results of those are updated on our website every day. Just an update on our hospitals. Since we are seeing increases in the community, as of yesterday afternoon, we had 158 patients with the coronavirus infection in Philadelphia hospitals and 271 in the region as a whole, including Philadelphia. That's a slight increase from 228 patients in the region 1 week ago. And so that is an increase. Still, though, it's only 15% of the peak of where we were in late April. So we're still quite a bit lower, and the hospitals still have plenty of capacity if necessary. Since this time yesterday, we've identified 2 additional people who died of the coronavirus infection in Philadelphia, bringing our total count of deaths to 1,675 since the beginning of the epidemic. Of those, 855, or 51%, are nursing home residents. Then just an update on our testing. We have many test sites in the city, 55, 56 at least. We are increasing the number of tests we do per day. We're now averaging more than 2,500 tests per day. We're continuing to have problems with long delays in reporting out test results from 2 national laboratories that are responsible for a substantial fraction of the tests done in the city. That is a problem, and we're continuing on working to try to redirect those lab samples to other laboratories in the region that might be able to report out the results more quickly. Then an update on what's happening about the epidemic across the region and across the country. In the past week or so, we've seen an increase in case counts in counties around the city of Philadelphia, particularly in Bucks County, Delaware County, and now Chester counties. And there are increasing case counts in Pennsylvania as a whole. On a more positive note, though, in New Jersey to the east, case counts daily are pretty stable. In the U.S. as a whole, the epidemic continues to increase, but not quite as fast as it did maybe 2 weeks ago. Now, some other states that were having major increases in cases have closed their bars and restaurants and required masks. And I'm hopeful that the closing of the bars and requiring masks is what's responsible for the slowing of the increase across the larger parts of the country. Back here in Philadelphia, we're now in July and in August, the schools and colleges will be opening. They are allowed to open under the current phase. We do believe that they can reopen safely, but they have to do so carefully, and they need to monitor very closely infection spread, if there is any, in their facilities. We have provided guidance for schools and colleges, and our guidance is posted on our website. And we're consulting individually with colleges as well as schools on their reopening safety plans. Then I'll talk just a little bit about outdoor dining. We do not allow indoor dining here in Philadelphia now because we're concerned about that being unsafe. It's unsafe because people are indoors where there's less ventilation, and people, because they're eating and drinking, are not wearing masks. However, we do think that outdoor dining can be done in a safer way, and a safe way if done right, if people follow safety precautions. Now, I've actually been around and walked around and seen a number of restaurants that are following those safety precautions very well, and that's great to see. I think many restaurants are doing that. We are inspecting inspectors to try to make sure that every restaurant is doing that. We want all the restaurants that have outdoor dining to do that safely. So I thought I'd just take a couple minutes out here to give some do's and don'ts for both restaurants who may be paying any attention to this, as well as customers, so what to look for in a restaurant that offers outdoor dining. So with that, I'm going to try to share my screen here. And show these pictures. And are you seeing my screen there, Kelly?
We're good to go.
All right. So just key outdoor dining requirements. I want to talk about masks, barriers, distancing of customers, crowds, as well as what restaurants need to communicate to people. So first on masks. People are getting much better at wearing masks, and that's great. But it's important for people to wear masks correctly. A mask should cover your mouth and your nose so that it can really catch any secretions that are going to come from your respiratory tract. So we have the mayor there wearing his mask correctly, as well as other folks. That's what you should do with your masks. This is what you should not do with your mask. Drop it below your nose, drop it down around your neck, or for that matter, cover your eyes. So it's really important to wear the mask correctly. It may seem like a small difference to have it over your nose or not, but it can make a big difference in terms of the risk of spread of this virus. What about barriers? Barriers can prevent respiratory droplets from going in the air from one person to another. And a barrier like this at the cash register can protect both the staff person at the restaurant as well as customers. So these clear plexiglass barriers, we've seen a lot of them around the city. We need to be seeing more of them. This is what you should do. And this is what you shouldn't do, where there's just no barrier, where there's not a sort of a second level of protection in case droplets escape from a mask, so you want to prevent it from traveling from one person to another. Then there's distancing. It's important that people remain more than 6 feet apart from other people at all times in outdoor dining, especially because when they're eating, they're not wearing masks. Now, being 6 feet apart means that the humans are 6 feet apart. It doesn't mean that the tables are 6 feet apart. So here's an example of where the tables are spaced in such a way so that the diners are more than 6 feet apart from each other. You want to make sure that people sitting at one table are not less than 6 feet from people sitting at another table. So it's not 6 feet from the center of a table to another center of a table. It's 6 feet from the chair to another chair. So this is how it's done well. Here's another sort of reminder that's helpful to people. Many people may not really know what 6 feet is, and so having things on the ground that indicate what 6 feet is can be very helpful. Here are examples where it's done poorly. These tables are too close together. The centers of the tables may be 6 feet apart, but the chairs are less than that. So people are too close to each other. People at one table could potentially spread the infection to people at another table. And we want to reduce crowds. Simply the more people involved, the greater the risk. The more people that are close to each other, the greater the risk. Here's a nice setup where it's very sparsely arranged so that there aren't crowds close to each other and aren't a lot of people. And here's some don'ts. Okay, so here's a place on the left where people are moving around, they're clustering together, lots of opportunity for spread. Likewise on the right where people are grouped around, very close to each other, lots of opportunities for spread. That's what we don't want to have happen. And then there's communication. People need constant reminders about what they should be doing. We have distributed safety flyers like the one on the right here to thousands of businesses at this point. And we've distributed signs about the requirement to wear a mask. And there's plenty of other signs like this that restaurants can put up on their own. But you need to communicate the rules clearly to people what they need to do. That's what you should do. There's nothing wrong with a sign that says we're open, but a sign that says we're open that doesn't communicate safety is not going to be good enough. We really need to communicate very clearly what the safety standards are. And then just a reminder, when our restaurant inspectors go to inspect a restaurant that is offering outdoor dining, they're going to be inspecting not just for the COVID safety precautions, but also they're going to be doing a full inspection of the kitchen. We don't want people to get salmonella or other food-related illness at this time when people are so focused on COVID. And so the food needs to be prepared safely. So all the regulations that have applied to restaurants in the past apply now, and our inspectors will be looking for all the things that need to be done to protect people from food-related illness at the same time they're looking for COVID-related illness. If anybody has any questions about how a restaurant ought to be arranged for safety or have complaints about restaurants, they can call this number, 215-685-7495. So that's information for restaurants. It's also information for, let me just stop my share here. It's also information for customers. I would recommend if you as a customer go to a restaurant and you find that they're not following the safety precautions, they're doing the don'ts there. Number one, don't eat there. You should give your business to a restaurant that is following the rules, and there are many that are that. And you should also let us know. If you call 311, that information will go to inspector, and our inspectors will go to restaurants to remind them about what the safety precautions are. That's the update for today. And if you want more information, just go to www.phila.gov/COVID. Thank you.
Good afternoon. Hello, Dr. Farley. What percent of the actual infection rate do you believe you're capturing with testing?
It's going to be a relatively small percentage. I don't know that I could estimate, give you a number. We know that many people have no symptoms. Perhaps as many as half of people have no symptoms, so there's no way they're going to be picked up. And then other people have symptoms that may be very mild, and so they may not go for testing. There was the study that we talked about in the last press conference where they tested people for antibodies, and they estimated how many people might have been infected based upon that, and looked at the ratio. And the ratio came to somewhere around 5 to 1 to 7 to 1. And that may not be far off, but I couldn't give you a more precise estimate than that. We know this is true around the country, around the world, that there are many infections that never are come to attention through testing.
And can you talk a little bit about what the implications are if testing is currently only capturing a fraction of infections?
Well, the testing is still valuable. It's valuable in identifying people who may be sick enough for medical care. It probably is also true that people who have symptoms are more likely to spread the infection than someone else. So that if people have symptoms are tested positive, then we can do contact tracing, and we're doing contact tracing around the people for whom it's most important. So there's still value to testing, even though there are many cases that we won't pick up. Testing by itself will not solve this problem. I talked about that the other day, but testing is definitely a key component to it.
And will you also talk just a little bit about how infection rate guides your decisions to prevent indoor dining, potentially expand some of it onto streets and sidewalks?
What we're looking at really is more than anything is the trend. Because if the number of infections per day is going down, that means that our safety precautions are making so that each person who has the infection is spreading it to less than one person on average, and we're moving in the right direction. If it's rising, that means that they're spreading it to more than one person on average, and so our precautions are not being able to, or over the long term, are not good. So we are much more likely to not ease restrictions and to potentially add additional restrictions if the daily case counts are rising than if they're falling.
Just unmute. Here we go. For Dr. Farley again. Dr. Farley, again, I want to speak to you a little bit about, again, the numbers among young people. Are you continuing to sort of think that these numbers among young people rising are still this idea of folks gathering socially and sort of just not being cautious enough, or is there some other reason now that you're seeing for cases to rise among young folks?
There was a period of time when we saw clusters of cases that appeared to be related to social events around high school graduation. That seems to have subsided. Now we're seeing a more general rise in people in their 20s and 30s. And we really don't know whether this is through social contacts or whether this is occupational contacts. or other exposures. It's certainly better to have people at that age get the infection than people who are 60 and above, who are more seriously ill, or who are potentially seriously ill. Nonetheless, we are concerned about infection in that younger group because they can spread it to older people that they're in contact with.
Dr. Farley, all the discussion about going to yellow and then green, and of course, Philadelphia remains in a partial sort of green position, while the outlying counties had gone to full green. But now, as we look at cases rise, not just in Philadelphia, but in the counties as well, does it not seem that the counties in Philadelphia are in fact linked in terms of how the numbers react and how many folks are contracting COVID?
Sure. The epidemic doesn't respect borders. And so more spread the epidemic in certain counties surrounding Philadelphia County is going to mean more cases in Philadelphia. So, we all need to we are all in this together.
If the numbers are, in fact, going up among young people, does it continue to raise real concerns about schools reopening? You've said they can open safely, but here it looks like as the region reopens, numbers rise among young people as schools open, particularly colleges. Obviously, there'll be more to gather. Doesn't this issue argue toward a more virtual approach to education going forward?
It's certainly that the more that rates rise among young people, the more we're going to be cautious about that. At the moment, I do think that schools and colleges can open safely. If we get sharp rises in those age groups between now and then when they're scheduled to open, then we may reconsider that. With this epidemic, it's always changing. As of the moment, I do think that they could open safely, but we always have to see.
I'm wondering, first of all, on indoor dining, is it still an open question as to whether that could begin August 1st, and when would a decision be made?
We did say that we would certainly not allow that before August 1st. We haven't set a date for when we're going to make that decision about extending it. I can tell you right now, with case rates rising, it looks unlikely that we would allow that to start August 1st.
Okay. And I know you mentioned outdoor dining, but as far as some of the other activities that have been able to reopen, like gyms and barbershops, can you comment at all on how you think that is going as far as people following guidelines there, and whether there's any enforcement or inspection happening with those?
There are inspections. If they haven't happened yet, they're going to be happening very soon in the next day or so. But I have no information back yet of what those inspections are showing. And so, I've seen communications from gyms that say that they're going to follow all the standards, and that's good to hear. But it's going to take us a little longer to find out exactly how that goes.
Okay. And lastly, Dr. Farley, I'm wondering if you could comment on how much contact tracing the city is currently doing, and how, if that's at all affected by increasing cases.
I don't have numbers for you. Our contact tracing team has been built up. It's a big, strong team at this point. I hope to have numbers for you next week. We certainly did not plan for numbers like this. We did not expect that we were going to be reporting 200 cases per day. So there's going to be some limits on contact tracing if we have case counts continue to be that high.
Hi, this is for Dr. Farley. Good afternoon to you, Dr. Farley. Just wanted to get your opinion about some daycare workers who are voicing some concerns about opening and being open and being exposed to kids at this point in smaller settings and closer settings. Just your thoughts about that, and do they have the guidelines necessary to make sure that their establishments are safe at this point?
We do have guidelines for daycares in addition to our guidelines for schools. I can say that in general, the younger the children involved and the fewer the children involved, the lower the risk is going to be. And so I do think daycares can operate safely. It's typically a small number of children who are very young. The risk is never zero in any setting, but at this point, we do feel like it's safe for them to operate.
Yes, hello. This is for Dr. Farley. I was wondering if you saw that South Korea study that a lot of people have been talking about the virus spreading among people between the ages of 10 and 19, and how that maybe they spread it as much as adults, and what you made of that in light of the conversation about schools.
I didn't read the study itself. I read a newspaper article about the study. I need to look at more. I know one of the experts on my team did read the study, and it's certainly reasons to be concerned. It doesn't, there are other studies that suggest that children are less likely to transmit than adults. So taken by itself, it's, I don't think we should conclude that teenagers are more likely to spread it than adults. So it's certainly, it's worrisome, but any one study has some limits.
Okay, and then about the dining, do you have any numbers, you or Mr. Carroll or Mr. Abernathy, about how many warnings have been distributed, or any fines or shutdown orders regarding outdoor dining?
I can tell you that we have closed a total of 7 restaurants for not following the rules around outdoor dining. I don't have numbers on warning because we don't track that. And the health department doesn't issue fines, but there are some fines that may have been issued by the streets department that does its own inspections about a variety of other rules that they need to follow for the streets department. I can say that, give you some general sense for our presence. Since May 1st, I want to make sure we get the numbers right, we've done 4,277 inspections of restaurants, and that's proactive inspections, and an additional 621 inspections in response to complaints. And whenever we do an inspection, we look for food safety problems as well as the coronavirus-related safety issues. So that's how many opportunities we have to look at those, any potential problems.
Okay, thank you.
This is for Dr. Farley in regards to the numbers of tests that we had today. I know you mentioned in the beginning that there was an influx or a huge number of tests, as you mentioned today. What would be kind of the average or median number, if you can give that? And is there a reason for some of these days where we have a major jump of tests comparatively to other days where we see a lower number? Follow up to that, when is the last time that we saw the number of COVID-19 positive tests here in the city over 200?
Yeah, so we do about, right now, about 2,500 tests a day. Up until recently, we were doing about 2,100 tests per day. So that's roughly how many typically we would report out. So to report out 4,200 tests is about double what our typical daily volume would be. And the fact that we got that many all at one time, I think is reflective of the problems that these national laboratories have in being backlogged and doing their tests. And so they get backlogged and then they do a bunch all at one time, and we get a dump of a bunch of results. And that's not ideal. It would be better if we got them every single day, but that's probably explains the larger numbers. As far as when was the last time we had more than 200 in a day, I don't know. I think we may have had one recently like that, but I'm not sure. We can look and get back to that.
Okay.
We do have, there is fluctuations through the day, a good deal of fluctuation in how many case counts, which is why I'm encouraging people to look at this on a weekly average basis, and I'm trying to summarize how many we had over the week that just ended.
Understood. I have one follow-up question for Brian. Thank you.
Okay, thank you. We're going to keep it on our COVID questions for now. I think Mike Carroll did just want to jump in on the last question from Jack. Mike.
Yeah, there was a question about how many warnings were issued, and Dr. Farley did mention that Streets Department is also involved in enforcement. So I can add that Streets Department sweep officers have responded to 57 complaints and also done 164 inspections, which resulted in 89 warnings and 19 violations. And that goes back to the start of outdoor dining, which would be approximately June 12th.
Yes, Dr. Farley, looking at all the vaccinations that are, or the trials that are happening and the ones that seem promising, are you at all concerned about the lack of African-American or Black participants in the trials?
I haven't seen any data on that. We certainly would want to make sure that there is plenty of African Americans who are participating in these trials so that we can have evidence that they, if it's effective in that population and if it's safe in that population. But I have not seen the racial breakdown in any of the trials.
Just a question, Dr. Farley, on how the restaurant inspections work, because so the state troopers are involved somehow, and people have been, restaurant operators were saying state troopers were the ones that like came to shut them down. How does that work? What's the relationship there?
I'm not aware of state troopers doing any restaurant inspections here. Now, they may be thinking of Liquor Control Enforcement as a state agency that is part of the state police. That may be what they're talking about. There are alcohol-related requirements and inspections and violations that may be issued.
This is Mike Carroll. I can confirm that there's been coordination on the sweeps and inspections, so it's likely that on some occasions, a combination of city and state people arrived at a certain scene to do each their independent jobs, as Dr. Farley's mentioned. You're muted.
Yeah, I couldn't unmute myself. Thanks, Kelly. So thank you for that, Mike. I guess you're right. Dr. Farley wasn't state troopers. It must have been the LCB officers. I'm just confused as how, like, who calls them? Because I had emailed the LCB and they were like, oh, we didn't call, no one called us. It was the city who does this. So how does it work? Like how did they get involved in the first place? I'm wondering.
So let me start to answer and then let Mike see if he can fill in some of the details. So Liquor Control Enforcement, which is related to the Liquor Control Board, but is a separate unit within the state police, they're responsible for enforcing the state's laws around alcohol sales. There are liquor control enforcement officers, and we do coordinate with them. There may be times when we inspect a restaurant and we might call them, or we might have a joint inspection with liquor control enforcement officers. So the call may come from us, or it could come from a complaint from a citizen.
Okay.
Yeah, that's right. And I will confirm that, in fact, state troop, liquor control enforcement, uniformed state police, I should say.